put the date out. Now, I have just discussed with my wife today, and I'm going to do another workshop, which is the same as March, in November, somewhere in November. I'm not quite sure yet. So if any of you are interested, please let me know and reply one. Obviously it's only for New Zealander. Acupuncture is in New Zealand. Any of you, if you are interested in my workshop, please reply one and let me know how many people are interested in my workshop, please. Now, thank you. So I'll work out the time and I'll send you an email. Thank you very much. Now, okay, I can see that, yeah, that's only for New Zealander, though, and because I don't think anyone from the outside would be able to come in. Yeah, and everything that I share with you today is in my workshop. But sorry, not everything, apart from the herbs. Okay, apart from the herbs, because it'll be the same as the March one. Okay, but if you have attained the March one, it'll be, you get big discount for it. You're not gonna pay for full price. Yeah, that's normal, right? So hi Joe. Okay, I can see that it's actually start recording right now. So thank you very much for joining us. We have 88 people at the moment. I think when I last checked, it was 200 something, over 200 something people registered. Yeah, we just started. Thank you. Okay, no sound. Okay, you might have to check. I don't know why no sound. Can you all hear me? I think Phoebe can't hear me. Can you all hear me? Yes. Nelly said can hear me. Okay, thank you. And Elena said you can hear me. So Phoebe, you might have to, I don't know what happened to you, and you might have to log out and log in again, or there might be some icon in there that you haven't turned it on the, I don't know, the speaker, something like that. To check that, please. Okay, now I want the things, Daisy and Kenny, because without Daisy and Kenny, we won't have this webinar. Because at first I was promising everyone that I want to do once a month, but I got too busy because filling the form to apply CPD. You got two CPD with ACNZ and NZAZ, but without them to fill in the form and applying and send you email, you get reminding email, you get email and send out to you, and those are all Daisy and Kenny's work. Okay, they spend time on it and bring this webinar, and I am only telling them, hey, I'm going to get this topic, and they did everything. So I'm very grateful for Daisy and Kenny. Then I click now and then. Can't hear a thing. I click down and oh, okay. I'm not quite sure what happened then. And maybe your internet issues, and use your home Wi-Fi rather than cell phone data. Okay, that's my advice. So after this, you have to join in the email that you receive. You have to join our Facebook group, and when you join Facebook group, you have to fill in all the details, whether in acupuncturist, yes, and where you from, and give us the email address. Then once you get all the details, and my team will approve you to access to the group. Okay, then all the certificate will be in the group. Okay, so you only get your certificate in the group, And from now start, if any one of you join us right now and until finish, then you get your certificate. If you leave earlier or you join afterward, you won't get your certificate. Okay, so let's make it clear. Thank you very much. And I'm pretty sure that we have more and more people would like to join, but because the time frame different, we are in New Zealand, now it's 8:09, but they are probably in other countries still working or sleeping, I don't know. But we have a recording. Every time we have a recording, and we have a platform, and in the group, you go into the group and we'll send you the email and let you know how to join our platform. And we put all the recording, Monday recording in our platform. Okay? Thank you very much. The Penny say I have no sound. Is Kenny here tonight? Kenny's supposed to be in here and helping everyone and how to get to no sound issues and technical issues, because I'm not good at that. Now, can any of you help if you see anyone that they can't hear because they're probably new to this platform? And if you face the same issue before and how did you deal with it? How do you fix it? Can you please share your experience with them? Thank you very much. No problem with sound. Okay, we're going to start right now. So today's topic is acupuncture and Chinese medicine to differentiate and address migraine. Now, first, we're going to talk about some idea about migraine, what's migraine and what caused migraine and what triggered, and migraine symptoms and symptoms that have two different phases. Then we're going to move toward to a case study. Okay, we're going to talk to everyone about case study. Okay. Now, right. What is migraine? What is migraine? A migraine is actually a neurological conditions that can cause multiple symptoms, right? Now, migraine is not just pain in the head. You know, it's not just that. Okay, migraine, it comes with a lot of other symptoms as well. It can be numbness, difficulty speaking, and sensitive to light, and sensitive to sound, and get depressed, worry. Some people get panic attack with migraine. Numbness, tingling, you know, all this together associated with migraine. Okay. And how do you diagnose migraine? Well, to diagnose migraine is actually not an easy thing because you have to run some certain some scan to rule out other issues. What other issues? Might be brain cancer, you know, eye disease. You have to, or neck problem. You have to rule out a lot of things. Then, okay, none of those. Then, yeah, you're having migraine. Okay. Now, some migraine, it comes, it can go without headaches at all. It can just be dizziness or imbalance. Okay, so really, a migraine is difficult to diagnose because I have to roll out a lot of things. It takes some time, and a migraine can be without pain. You know, simply just dizziness. So migraine, it can start when you work very little, and it can happen once or twice or ongoing. It can happen once or twice when you were little, teenager, kids, and it stops until you work again, or I don't know, maybe some stress coming, or you after marry, or something like that, and you start to get migraine again. So really, there is no pattern when you're gonna happen, you know, and there's no sign. We'll say, well, if you have a migraine when you're little, you will get your migraine when you're old. No. Some people, when they're little, they don't have any migraine, but they started after work, or started when they go to university. Yeah. Can be anything. Now, female cases are actually more than male. Why is that? Because there's a type of migraine which is hormone imbalance that causing the migraine. So when they have bleeding, monthly menstruation, they get migraine. And some patients get that every month. That's how bad it is. That is why woman is winning in here. Unfortunately, female is winning today. There are more cases in female than in male. Okay. The symptoms. Okay, migraine symptom can begin 1 to 2 days before the headache itself. Okay, so which means there's early sign of it. If you suffer from migraine, you know it. My patient know it, and I always ask my patient, how could you? Because to be honest, I don't have migraine, and I very rare that I get headaches. And the only time that I feel headaches was flight from Malaysia to New Zealand, and the flight. I was on the flight airplane, and I started to get pain, very painful in my head, and for about 5 to 10 minutes. And I keep pressing my Herku point, large incision 4, and it helped a bit, but it didn't help. It helped, it didn't help. And then after 10 minutes, everything's gone. That's the only thing that I can. Probably, and when I was little, I had some. I didn't know that. When I have a cold, I don't get migraine. I don't get headaches. A lot of people do, but I'm the one who don't know about headaches a lot. Okay, but I treat a lot of it. And so in patient, I asked them, how could you tell is migraine and headaches? And my patients share with me. So I learn a lot from my patient, to be honest. And my patient said, well, migraine, the difference between migraine and headache is headache, they can take some painkiller, that's it. Migraine, at the end of migraine, no medication can help them. They have to shut them down and go to bed and close all the curtain and no sound and be in bed by their own. Very sensitive. And they say they'll get anxious for it, and the pain is not going away. Doesn't matter what they do, they just have to be in bed. Okay, and make them vomit, dizziness, something like that. Okay, and headaches is something. If they get headaches, they can do some acupressure point, and they can put some heat pack or painkiller would always help. That is my patient. Most of my patients share with me in this way. Okay, so migraine before headaches. Okay, the first stage. Okay, before really you get headaches, some people get food craving. That's probably an early sign, or chocolate cake craving, or things like that, or depression, fatigue, and low energy, or frequent yawning, hyperactivities, irritability, neck stiffness. Now we know headaches, it can cause from the neck, and migraine too. Okay, so you have those, but not everyone have these 4 phases. Like, it's very clear: first, second, and third, and fourth. It can be all bunched up together, But some people do have these phases. If they do have this kind of phases, is a kind of good thing because they know it's coming, and especially in here, in this first phases, most people they take some medication. If the medication work for them, they take the medication before the real headache actually attack them, and they can actually prevent it to come. If after this phases they didn't realize it's coming, or they ignore it, when they get headache attack, migraine attack, and they start to take medication, most of the time it doesn't work. Most of my patients say it doesn't work for them. They have to get suffer from migraine in 1 or 2 days and even a week. Usually high pressure with high altitude may cause migraine. Yeah, yes. It could be anything. Could be anything. Everyone's different. The patient know better than us. So we have to ask them. I always ask them, do you know what triggered? If you know what triggered, you know how to manage it. Okay. Now, in migraine with aura, the aura occur after the prodrome stage. During an aura, you may have problem with your vision, sensation, movement, and speech. Example of this problem including difficulty speaking clearly, feeling a prickling and tingling sensation in your face, arms, and legs, seeing sharp light flashes or bright spots, temporarily losing your vision. And some people can lose their vision just one eye, some both eyes, and it'll come back. Now, the case today that we have, to be honest, is very rare to have speaking problem and pain, tingling, like this is something that you see I just mentioned about. Like what? Like stroke. Like stroke. Okay, and you can ask them to raise the arm, you know. And the stroke patient, they can't raise the arm. They can raise one side, but the other probably can't raise. And this patient, they couldn't raise. It really looked like stroke. They probably have body they can't move. And how do you know? Go in A&E. You don't know. So when these people happen, that all the similar things like stroke, they really need to get a CT scan to rule out that it's not a stroke. You can't tell. The symptom is so similar. It's so similar. The only thing is get CT to rule out. Yes, period can cause migraine too. Thank you. So the next phase is attack phase. Like attack would mean you really get migraine. You really get migraine. You get headaches. Okay. Now, increased sensitivity to light and sounds, nausea, headache with nausea and even vomiting, and dizziness and feel faint. An imbalance, they can't walk, they walk wobbly. Pulsing or throbbing head pain. Okay. And pain on one side of the head, either on the left side or right side, front or back, or in the temples. Okay. In Chinese, we call 偏头痛. 偏, which means on one side. And which means in here and not the other. But actually, in reality, some people get it only in here, some on top, some on one side or the other side or on the back. Some can be in the whole head, not just one side. Okay, that's migraine. Now, how do you know? You don't know. You have to ask your patient. Now, this is important. When it comes to acupuncture, we all do acupuncture, right? Any of you are not acupuncturists, only do herbs. Yeah, it made like a band around the head. I don't know about you. When I was in university and we talk about migraine, when we just talk about prescription the herbs, okay, we're not talking about acupuncture way back there, okay. Then there is one term called 引经药, which means you can use some herbs to go to some meridian to treat headaches. If the headache migraine is on the forehead, it's called Yangming headaches. It's on the side, it's called Shaoyang headaches. It's on the back, it's called 太阳 headaches. On top, called 绝阴 headaches. Have you heard about this term? Have you heard about this term? On the forehead is 阳明. Headache on forehead, 阳明 headaches. And what do we use? What do you use a herb for? On the back, what do you use herb for? 葛根, right? On the back. On the side, 柴胡. On the top, 吴茱萸. Right? On the front, 白芷. That's the herbs, right? Okay. If you heard about this, now I want to ask you, is it right? Do you use it in your clinical? Do you use it for your patient? When let's say, if your patient come in, they have fun headache, and you say this is 阳明 headache. What is 阳明? 阳明is stomach and large intestine. So you need those stomach and large intestine. That seems right, right? It seems right? Now, have you ever used it in that way? Does it work for you? I want to know your experience. Share with me. Does it work? What part do you use for fun headache? Forehead. Okay, you use needle ends that used to stop addressing the headache type. Great, David, great. Good one. Now, Chundi said, so Chundi says stomach 36. Junko said no work. I think Junko, you said no work is herb doesn't work well and acupuncture is better, right? I think it never really use it. We mainly use some tuina and manipulation. Okay, great. This acupuncture and Chinese is just one of the other ways. You know, there are many ways to treat migraine. There are many ways. Yeah, massage. They all can work. You know, it all works. That's great. GB20, which is spleen 9 and lung 5. I use stomach 8, large intestine 4, and it works well. That's great. That's great. Okay, but is there any, like, let's say stomach 8, large intestine 4, or spleen 9, lung 5 for forehead? Do you have any experience that it didn't work at all? You use that, it normally worked, but it didn't work this time. Large intestine 4, level 3. Thank you. Yeah, 4 gate. Is it 4 gate? Large intestine 4 and level 3. I assume it is. Eddie, thank you. Thank you for sharing. 4 gates. Yeah. Does 4 gates always work for all headaches? Or sometimes it doesn't work? That's my question. Does it always work? So what your strategy is, not always works. That's what I want to hear. Because I tried it myself. It doesn't always, not always. Okay, yes, I had one case of a person that removed her gallbladder 34 years earlier, and it never stopped. That case, I wasn't able to solve it. Yeah, you see, there's always some cases that we can't deal with. There's always some cases we can't deal with. So you want to find as many tools as you can. You know, if this doesn't work, then you change your tools, you change your method. Okay. Thank you. You guys being very honest. Yes. And thank you for sharing. Yes, sometimes it doesn't work, eh? If anyone told you that it always works, and I would really doubt it, to be honest. Maybe you're right. But in my case, in my experience, 4 gates, it works for some cases. but there are cases that doesn't work. It doesn't work. Okay, so that is very honest. Okay, let's have a look. If you're saying that front head is Yang Ming headache, that's not actually all right. Okay, because Yang Ming meridian come to here on the side. That's Yang Ming stomach meridian. Front head, what meridian is that? If above the eyebrow, in the middle above, in this area, that is Sao Yang gallbladder meridian, gallbladder pain. Okay, so diagnosis is very important. Then if you go to here, this in of closer to the nose, closer to the middle, closer to the two meridian here, this is bladder meridian. Bladder meridian headaches. On the middle, two meridian headaches. Over here, stomach meridian. So 1, 2, 3, 4. 4 meridian involved with front headaches. Does it make sense to you? When we call about headaches, migraine is the same. On the side, yes, on the side, or Sao Yang, it can be Sanjiao and it can be Sanjiao, it can be gallbladder meridian. Okay? Then what else? If patients say, well, I've headache in here. Well, here you see my hand. Sanjiao and gallbladder on the side, but here is actually stomach meridian. There's 3 meridian there. So really, you want your patient to use one finger to point out where exactly the pain is, which area. Then you know what meridian actually involved. If it's in here, if pain in here too, that involved with 2 meridian, that involved with what do you call it? Bladder meridian. So you really want to know. You ask your patient. I know you are expert. You are an acupuncturist. You need your patient to point it out for you. Don't just go for headaches in the front, right? Yang Ming. Then think about it. If your diagnosis is not right, that is why when we needle forget, sometimes it doesn't work. That's why when we needle forget, it sometimes doesn't work. Okay? Forget works because liver can help with gallbladder, right? But liver gallbladder, it can't help with this. It can't help with the bladder meridian. So sometimes forget doesn't work because it can't balance the bladder meridian. Does that make sense to you? Yeah, back headaches, bladder meridian. That's it. So I just want to point out this when it comes to here. All right, the attack phases. Then after that is what? There is post-drum phase. And post-drum phases is more like you probably have some little bit of pain, but not too bad, and it get more emotional. One is very exciting. That's good. I don't have headaches anymore. I went through a migraine. I'm still alive. That's very happy things happen. Some is so down. Say, oh, crap, I have migraine again. And you're so worried that the next migraine come again. It just exhausts a very low energy. So it's more about the emotional in here. Okay. Okay. Now I want to so all these 4 phases, it's all different lengths. Okay. And the intensity of these phases can be very different. And those phases that it can go, as I mentioned before, it can bunch up all together. It started with tingling, vomiting, light sensitivity with headaches. Straight away, it all bunch up together. It can be no sign. It can be sign. early sign. So what is the pain? What kind of pain that migraine get? Pulsating, throbbing, perforating, pounding, debilitating. So some just dull, or some is just achy, or some get heaviness. Can be anything. So we don't know, right? It can last for, few hours. It can be few days, can be weeks, it can be months. Who knows? We don't know. I have a patient that suffered from migraine since she was 13 years old. Now she is 40. Yeah, the pain is mainly and go by the meridian, pulsating type and behind her eyes, very relaxed to relate to menstrual period. She has memory problem, hair loss, polycystic ovary, and endometriosis. She tried herbs, acupuncture, Western medicine, and none of them work. Okay, now it will work for you. You might be the one who treated him. Now, I'll tell you all Western medicine, Chinese medicine, and acupuncture, all good method, and not just relying on the acupuncture and Chinese or Western medicine, because lifestyle change is very, very important. You want to find out the trigger, and we know the trigger, then you have to prevent the trigger. Okay, that lifestyle is very important, not relying on treatment. Treatment can help, certainly. Blood letting is another method. There's a lot we talk about. Okay, what causes migraine? Unfortunately, we don't have things or something to test you and let you know what exactly causing migraine. Nothing. Okay, it's all about the research and study, and none of them tell you that exactly what happened and what exactly it is. Because if you say stress, some people have stress, they don't get it. Sometimes they get stressed, they get it. Really can't tell. Okay, now they are trigger. The trigger fact, the factors of the fact of the trigger. Bright lights can be one of them. Severe heat, or in a very hot area, room, or the weather is very hot. Dehydration. In dehydration, I do have patients have headache and migraine, and once they drink more water, it subsides the headaches, and that's good because it's actually causing from the water, and that's easy to deal with, isn't it? You just have to make sure that you got enough water. Hormone change in women, such as estrogen and progesterone, okay, and that's the harder one because a lot of people have it. You need to treat it for a while. You can get the migraine subside pretty quick, but it comes back every month. Then you need to treat the period. You need to treat the menstruation rather than just treating the symptom. Because when they have migraine, that's because they're bleeding. And the period, menstruation. Treat the menstruation. Regular hormone, regular menstruation, then you'll be able to prevent the migraine again. If it's in pregnancy, then that's difficult. We have patients come in, headaches, and the whole body painful, and the first baby went through all along and she couldn't eat. It was awful. At hospital, about 40 weeks, 38, 39, 40 weeks, I can't remember. Then she came in for second baby. She came in very early, get acupuncture throughout until she gave birth. We didn't actually fix it. Why did I say that? Because we will be able to reduce the pain, because it's hormone, because it's pregnancy that causing the headaches and the pain in the body. You know, it exhausted. So we get acupuncture help, then maintain the pain. The pain went away and come back, went away, come back. Weekly treatment throughout until she gave birth. As you go after giving birth, and things went back to normal. No need treatment. Headache's gone, pain in the body's gone. You know, that's because she was pregnant and the hormone change that causing the pain. That who knows that anything that it can help her in next pregnancy, we don't know. Who can you tell? I can't tell. But if you know how to do it, let me know. We would like to know. Okay. Excess stress, a lot of stress, and now noise, all this thing can be trigger. It can be the trigger. Okay. What causes migraine? Again, intense physical activities. So some people go for run, training too much, and skipping meal. Okay, I have patients skipping meal. They're causing this. And this patient, a few months ago, we discharged her, and everything's fine, pretty much. And she had IBS, and as well as migraine and neck pain. And what happened is she told me that she recently had migraine. Last I saw her, and she said, I said, well, you know what triggered your migraine, right? She said, yeah, I skipped the meal. When I skip the meal, I get migraine. Okay. I said, why did you skip your meal then? They said, well, I normally prepare my lunch at work, but because they have meeting at lunchtime, then the company actually provided meal. That's good, right? But you can't eat them because there's gluten in it, there is dairy in it. She's gluten and dairy free now. A vegetarian diet, a vegan diet. She can't eat it. If she eat any of it, she end up with a lot of pain in the tummy. You know, end up with loose bowel motion. And she didn't want to end up with that. But because she skipped the meal, then she suffered from migraine. So you see, that's not a good solution. I said, well, you can prevent it. So what I said, that because you know you can't skip meal. If you skip meal, you get migraine. And you know you can't eat the crab that the company provide you, because if you eat the crab, you get a tummy problem, right? So what can you do? Just act as normal. If company have meeting, okay, let's just go meeting. You provide your own food. You do it every day anyway. You know, you do it anyway. So forget about your company providing your food. Doesn't matter what, you just do your own food every day. So you won't get IBS symptom, irritable bowel symptoms, and you won't skip your meal that causing your migraine. So this is how you prevent migraine. If you know where it comes from, if you know what triggered, okay. Use of certain medication, yeah, the pill actually causing migraine. You know, stopping your bleeding that causing migraine. And I've seen this case because the hormone out of balance. Certain food, some smell or certain food. I remember when I was little, and I couldn't bear the car. There's an old car, and we live in Malaysia, and under the sun, it's very hot. If you get into the car, oh, those smell terrible. I didn't end up with pain. I just vomit. I get car sick with that smell. Any car is fine. You go in, no problem. But if that got smell under the sun, the smell, it make me car sick and vomiting, and I get dizziness. I can't bear with those smell. Too difficult. But I was silly. I didn't tell anyone. Not until I thought about it. I can still remember those smell. It's horrible. It's horrible. Okay. But anyway, this is not about migraine. It's about the smell, unusual smell. In certain food, what sort of food? Caffeine. I want to name out caffeine. Chocolate. Some people get chocolate, they get migraine. Some with coffee. Now, I want to tell you, sometimes coffee fix the migraine. fix the headaches. I have patients, when they have migraine headaches, they drink a cup of coffee. That's it, fixed. This is what they told me. The way that they deal with migraine or headache, drink coffee. But some patients, they couldn't do coffee because as soon as they take coffee, oh, smell nice, have a cup, have a little bit, try it, migraine. Whoops. What's going on? Okay, smoking, alcohol use, overuse alcohol, traveling. Those are the trigger. Okay. Now, okay, case study. Let's start the case study today. So this patient, this is the patient fill in the form and use various medication, including steroid or anti-seizures medication, because they don't know what's happening with this case. So they use a lot of medications to try it out whether it helps or not. And she got side effect of it. And she's actually a practitioner as well. She worked in the hospice with cancer patients. So what are two main things that you would like to achieve by the end of this treatment session? She hoped for treatment and cure. Wow. The practitioner actually put down that you want to cure. And you can't say you can cure anything, but practitioner is a patient and they do want cure. But when they treat patient, they won't say, I can cure you. That's kind of weird, isn't it? Okay. She said, I have been off work for 6 months. That is, yes, cure is a dangerous word, isn't it? It is. Fix is a dangerous word as well. So we don't do that. We don't say that. You may mislead your patient. So we don't do that. But a patient, think about it. If you have a form for patient, how many patients actually put down that I want to cure or blah, blah, blah. I want to cure or blah, blah, blah. You see? I want you to fix me, blah, blah, blah. How many times do you see all this thing in your new patient form? Yes, a lot. Okay, migraine prevention. This is what you want as well. Treatment. She had high blood pressure. High blood pressure. I want to mention this. The high blood pressure is actually mainly when she happened when the migraine happened, that she suffered from high blood pressure. In general, she didn't have any high blood pressure, but because of that, and she put on a high blood pressure pill, and she usually on medication of high cholesterol. Okay, that's it. And she pre-diabetes, high blood pressure. Or there's a lot of things that you can have a look on itself when you get the PDF. Okay, we're gonna go to here. Okay, it's too small here, isn't it? Didn't realize that. I thought I put it big here. So she had the headaches happen for her. You can watch, you can see this. Okay, I'm gonna explain to you in here in my mind because I just did a Chinese webinar, the same topic last night, so I still remember all those things. When I go through it, I know what's going on with this patient. And when it happened, that 12 years ago, it happened once, and it got all right. And then it happened again in 2018, in January, and she couldn't move for half side of the body. And she couldn't speaking not good, and tingling numbness on one side of the body, can't move, and send her to the hospital, get a CT scan, MRI, rule out it's not a stroke. So they've done a lot of tests and rule out that it's none of the others conditions or disease, and they put it in migraine. So the migraine for her, very sensitive to sound and light, so she wears sunglasses, and sounds. And when you walk into our clinic, we normally have a music. If any of you came to my clinic, you know we only have one song for the last 14 years. Every day we keep it simple, just one song. And when patient came back to us probably 10 years ago, it been here, and they came back now 5 years or 2 years ago, you still have the same music. Yes, we never change. It's so funny. And I have to turn off all the music, everything, be quiet. And I have to turn off the fan. We have an extra fan in our clinic, and we have a dryer, washing machine going on in the staff room. And sometimes make some noise that you can hear. In the toilet, we have the extra fan. I have to turn on everything just for her, because that will bring the headaches, migraine. That's how serious her case is. Okay, she said she experienced like a head explosions, like the force is actually coming from inside, like she want to expose it, like there is something in that one that came out. That's what she explained to me. Okay, and she imbalance. And when she talked to me the first time, she need to try very hard to talk, and you know she's trying to make all the word clear. So she had constant pressure on the head, and it's something like some pressure pushes it out to the ear. Some pressure pushes out to the ear. Okay. Yeah, foggy head and imbalance. She's walking, and she's walking. She need to hold the wall and the whole way to come into my office. Now, bloating and sleepy after meal. Trouble staying sleep, wake up about 2 or 3 times, very low energy, scary dream, hot flasher most of the day since migraine. The hot flasher make her nausea. The heat actually comes to the headache area. Vertigo, dizziness, right? Puffy and swollen feet, ankle, and hands. Are ongoing things. Low libido, cold feet and hands most of the time. Shallow breathe occasionally. Dry cough for 2 weeks since flu. She had a flu, and that flu caused her left upper back pain, sharp one. Difficult to make decision with foggy head. High cholesterol, high blood pressure. That was the plus high blood pressure. That's so funny. However important to remember how noisy can trigger memories. It is. I have a friend who did his PhD in noise. How noise is actually causing a disease. And he went to a lot of cities in New Zealand to find out the research. And he found that actually a lot of disease actually linked to noises. Yeah. When it comes to migraine, they don't like migraine patients. When they have migraine, they don't like noise. They just want to be in their own. They just want to in the bed. They don't want anyone to disturb them. Okay, treatment plan. With this treatment plan, I said, well, you have to come twice weekly for acupuncture for the next 4 weeks, and I'm going to give you Chinese herbs. Once a week, we're going to prescribe the herbs, and every time you take 7 days of herb back and take it every day. Then I said, well, you have to watch a video, dietary review and suggestion, and emotional daily practice, and 3-to-1 acupressure and breathing program. And that's what you need to do. And I say, well, you need to put a heat pack on the abdominal on top of belly button, but because you have hot flusher, it might not suit you. You want to try it out. If it's fine, then you keep the heat on your belly button 30 minutes daily. If it actually triggers your migraine or it gives you more frequent of hot flusher, don't do it. Okay, so our goal is to reduce the pain, the headaches, and migraine, and to get your bowel motion more socialized, and to get you sleep better, to increase energy. Yes, so you have runny bowel motion, loose bowel motion too. Increase energy to get sleep better. This is all the goal. Now the goal is not gonna. When I set a goal for patient, we set it together and I ask the patient, is it what you want? Is there anything that you want to add on more into your goal? And the patient, no, this is all I want. Oh, the patient, oh, I also need blah, blah, blah. Okay, I'll just add it on. This is the goal. You make the goal with the patient. You just please don't come up with yourself. The reason I have those goals is because patient put it on the form. We ask the patient what they want, and we set the goal together. And the goal is not. I don't apply randomly. I'll apply the heat pack on the pain area. But I ask the patient, whatever you apply the heat pack on, whatever area, make sure you put one on your belly button. If you join my workshop, you know why I did that, right? As a reason, we always treat the root, treat the organs, not just treating the symptom. You can get heat pack to reduce the symptom. There's no problem, but treat the root of the problem rather than just treating the symptom, the conditions. Does that make sense to you? Okay. So all the goal, we set it up. I give you 1 month of treatment plan. It doesn't mean we're going to reach all the goal in 1 month. You have to make sure to the patient, goal is goal. The strategy, the treatment is strategy, the treatment. It doesn't mean the strategy and treatment can reach your goal in 1 month. That's why we need a re-examination after 1 month, 4 weeks treatment, sit down and go through everything. What has been improved? What has not been improved? What can we do? And have you been doing a home program or not? We're going to discuss all this to remind your patient they need to change their lifestyle. To remind your patient, to ask your patient to ask the patient whether you and your patient are still on the same page. Some patients they forgot about the goal, and they forgot how much better they are. So you have to write down everything in the initial examination. Okay. You can, if you wanted to, use ginger on the belly button. If you wanted to, yes. I just do it simple. You want something that can be easy to follow and not too much hassle for your patient to follow. So I find heat pack is much easier than moxibustion or then a heat lamp or ginger on top. Too much hassle. But I'm not saying you can't do it. It's great. It's even better. It's even better. But is it practical? Can your patient do it over day and weeks and weeks and months and months? Even heat pack, they sometimes forget. And we're here to remind them again and again and again. Okay. Now, first visit, she says she's in pain. She's not comfortable. She wants some treatment. I say, well, this is our initial examination. I can quickly make some herbs for you, but unfortunately, I can't give you acupuncture because I have a patient waiting behind you. So she said, yes, herbs is fine. So I took the pose. If you've been to our class, you know. I take the pose. It's a female pose, right? So both sides, both hands, 寸关尺, right? 寸关尺. So the normal pose should be feeling 3 fingers on both sides going down. This is my right side, which means your patient's left side. This is my left side, patient's right side, right? So 3 fingers at the same time going down, and I should feel the guan first. And then secondly, I should feel the chi first. Thirdly, I should feel the chun. It should be that straight on one side. And how about the other side? Same. And we feel this, and it need to match the opposite. This is the balance pose. Of course, it won't be that far, right? I just showing you. It can be just little bit. It can be just little bit like this. Okay. Now, if this is just trying to let you understand what's going on, and it need to match, which means if I feel the pulse of both guan, I have to feel them both at the same time, and Chi at the same time, Chun at the same time. Okay, I didn't tell you the heat pack on belly button. Heat pack on belly button is trying to bring all the circulation into your belly button and try to make more circulation in the belly button, because most of your organs, apart from the heart and lung, on your chest, but the rest of it actually on your tummy. So you put a heat pack on it to bring more circulation. With more circulation into your tummy, into the organs function better, and you get better. Simple as. Now, I do all this because I have the idea first. I have the theory first, according to Chinese medicines. If you don't have the idea, you don't have the theory, you don't have the method. Does it make sense? Okay, I take the herb pulse. This patient, I put my finger down and I feel this pulse first. Chun. The left chun. I feel the left chun first. That's it. It should be like this, right? But chun is like this. The chun is in here. Then what do I know? The left chun represents lung and large intestine in female. So I say lung too strong. I should say metal too strong, because it's not just represent lung, it actually represent large intestine as well. Okay. So okay, herbs. I use bohe. Well, I don't know about the English, okay? You can go for English and I go for Chinese, okay? I never studied Chinese in English, but we have a system. I type it out. The Chinese came out and the code, the number, you can see the code S. Bohe is mints, right? S332 is our herbal label from the company. So my receptionist, they can't read Chinese, but they can read the number, okay? And they can read the English. But don't ask me the English. I don't know all the English name, but I know all the Chinese name. So I write it in Chinese. We have a abbreviation. I can't remember what they call. But anyway, you just type SN and come out to Szenan. Bohe, BH, come out Bohe, you know. I just type, or actually I type lung, LS, LUS1, and all the herbs came out. Okay. So Bohe means 4, Szenan 9. 4, 9 doesn't mean is gram, okay? It's just little spoon. Very little spoon. I didn't have it in here. And if you attend my workshop, you know what I mean on the spoon. Okay, I show you in my workshop. For the heat on belly button, on top of belly button, half an hour, at least half an hour. That's good enough, half an hour. And so to reduce metal lung, right? And then I tonicify liver. Why I tonicify liver? So the next formula 2 is tonicify liver is Chai Hu and Wu Zhu. Chai Hu 8 and Wu Zhu 7. Now, do you have an idea that metal against wood, right? You want to reduce metal, you reduce metal. When you reduce metal, you increase wood. The wood will come back, do the opposite against the metal. That's why we increase the function of liver, reduce the function of lung, metal. Doesn't make sense. So this is my treatment. Okay, that's for herbs. Okay, the first visit, right? We have to go a bit faster. Second time she came in 2018 August 2nd. This pose is different. I take the pose. The pose will be like this, right? But the patient pose on that side, which is the left side, when I put my hand down, I feel this again, and Guan and Ci. I feel on that side, again the same. Now both Guan are lower than Chun, and Chun is bigger than Guan and bigger than Ci. But unfortunately, they are not matching. This side, which is on my right side, is patient left side. The left Chun, which is lung and large intestine, is much bigger than the other side of Chun. So in this 黄帝内经灵枢 chapter 9 say yang stronger than yin, called 人yin. Yin stronger than yang, called Michael. Okay, they're talking about the pose. So what happened when you got this pose? What happened? 人yin. We know the yang stronger than yin. And this is quite big. The most stronger one. So we end up with is this problem. And in this Chun, what is this Chun? This Chun got is metal that's including large intestine and lung, right? There's barely relationship, right? Now I tell you, if this is large intestine, this is lung. If they stay in here, same level, which means balance. Balance. What's in balance? This is in balance. This is in balance. One is stronger than the other, or that one's stronger than the other, that one's stronger than the other. Okay. So which one's yang? This is yang because this is large intestine, and this is lung is yin, right? And running means this pose. Running means the yang stronger than yin, which means the large intestine is stronger than lung. So that is my diagnosis from the pose. I don't care about what the symptom is. I only care about the pose. Okay, right? Running, what I call 人灵三照 is actually the meaning of 人灵三照, because 人灵三圣而照 in Chinese. 人灵三圣而照 means the organs of 三照, and 人灵 means the large intestine is work harder and stronger than lung. And this is your diagnosis. This is your diagnosis. And what is your principle? The principle is simple. This is strong, right? Reduce that one, improve this one, tonify this one. Reduce large intestine, tonify lung. That's it. Right? That's it. Simple. Very simple. So don't be too complicated and because they have this symptom, you have this symptom. I'm not saying you're wrong. Okay. I'm saying that how could we do it easily and don't confusing yourself. Using the pose is a great way. Using the pose. I'm sorry if you look at this clinical notes. I'm not talking about tongue because I don't care about the tongue. Sometimes I try to do the tongue, take the picture, and too much work. But in this case, I didn't do any tongue. I just simply used pose. Okay. Now, 五位子 and 细心, 五位子 9, 细心 4. And in acupuncture, now this time I give you acupuncture. Acupuncture is tonify Tai Yuan, and Tai Yuan is lung 9. Tonify lung 9. Why Tai Yuan? Why lung 9? Because when you tonify, there is a principle. When you tonify, when it's weak, you tonify the mother. When it's excess, you reduce the sun. Right? Reduce the sun, and on the large intestine is strong, too strong, excess. Then you reduce the sun, and the sun is large intestine 2, 二间. reduce the sun, and tonify the lung. Only 2 points. And what happened? The patient feel better straight away. 7 of 8, very tired after acupuncture. Only 2 needles and she felt very tired. You see, not every patient suitable for acupuncture. Some patients, they felt very tired. Some patients feel energetic. Some people, I don't care. You can put me on 100 needle, 200 needle. I just feel fine, right? Some people say, well, no, I can't bear it. I have patients after acupuncture, lay down the next day, couldn't get out of bed for about weeks. That's terrible. I never thought of acupuncture could make it worse. And energy, you never know. You try it out. You ask your patient, how did you feel after last acupuncture? Did it help? Did you bring up your energy? No change, or you get decrease of energy? So you need to ask your patient. Very rare that patients say that, well, I have to, in all my last 14 years, I have only one patient that say that after acupuncture, I feel very tired and I have no energy for 1 week. And it only happened with one patient. But that's good enough, though. You don't want your patient after acupuncture and feeling lack of energy, you know. But this is the real case that Phua Ltd said about if yin and yang and blood and qi are all weak, don't use acupuncture. Use Chinese medicines instead. So I never thought of my acupuncture would make patient feel weak. Then when I went back to Phua Ltd, wow, Phua Ltd already told us that. But no one told me that before. Right? So not everyone suitable for acupuncture. I know when acupuncturists, we believe that acupuncture can treat everything, right? But that's not the case. Now, headache is not too bad. No, headache's not too bad. That's good, which means the last 2 treatments with the herbs in the acupuncture treatment is working. Andrea said, we had a patient who had an emotional breakdown once during an acupuncture session. Somehow it triggered a past trauma for her. Yeah, that happened too. Or put needle on patient, the patient just cry, and not just once. It happened a few times, not just me, my colleague too. And we walk in, what happened? I don't know. I just cry. Can you take out the needles? And some say, that's fine. Just keep it there. I feel good. We don't know what happened sometimes. And then actually some emotional came out. It helps. Yeah, not fun at all. To be honest, not fun at all. With those, not fun at all. But some people ask for if they have crying and they ask actually for needle out. We take out the needles. But some people say, no, leave it. I feel better. That's good. Crying is so good. They want to cry. You know, that happened a few times. You know, that happened a few times for us. Yeah. It doesn't matter what kind of acupuncture. Electroacupuncture can make patient weak as well. How do you know? You have to ask the patient. Especially because we treat internal disease. We're not just treating pain. We treat patients that come in with fatigue. You know? But, yeah. Something like that. Yeah. Yeah, some people get it even from yoga doing back bends, start crying. Oh, good to know. I don't practice yoga, so I don't have the experience, but thank you for sharing. Corinne, right? Thank you for sharing. Okay, now 7th of August, the patient came in. I took the pose again. You see, in the first time, the pose was this. The second time the pose was this. But the third time, the pose went totally different. That is fine. It's this one that's the highest one. Dun, dun, dun. And this on the opposite chun, which is the right chun. The right chun is very strong. Then I changed the herb. The right chun is hard and small intestine. Hard, too strong. So we use Phua Ltd 2, Gui Xin 7. So Gui 2 and 7 days. So if heart's too strong, which fire is too strong, then what do? You tonicify kidney's water. When kidney's water came out, raised, it came against the heart, the fire. That's what I do. We tonicify kidney. 汉莲草 6, 桂枝 1. Simple. 7 days, 2 different formula on 2 different organs. Then how do we do needles? Here's the needles. Wow. In time, make your patient all cry every time, emotional. But the thing is, if they get emotional, they cry, do they feel better afterward? That's the most important thing. If they feel better, that's good. If they feel worse, that's not actually good. So you ask the patient, but most time when patients cry after acupuncture, they feel great. They feel relief from acupuncture. You know, that's what we want. You know, I say quiet. Today I have patients shaking with acupuncture shake, both hands shake. And she asked me, I said, she suffered from anxiety. I said, do you have anxiety? Is it panic attack right now? She said, no, I don't feel anything of this. I said, okay, don't worry then. It's the effect of the acupuncture chi. He said, does that happen before the other people? I said, yes. My patient shake. And the first time I see the patient shake, I was worried. And the patient said, can you please take out the needles? And I will take it out. And the patient never came back. Not until I found out, no one told me that is the worst thing. Not until I went into how to needle, tonify the chi and reduce the chi, regulating the chi. And I understand, oh, it can happen that way. It can happen with shaking. And the patient feel, oh, shaking. Why am I shaking? I said, that's normal. Can you feel any energy going to, whether it's warm or cold, going to your body? She said, no. I said, that's fine. Don't worry. And the patient feel better afterward. She suffered from high blood pressure. And after needles, 158 today and down to 134 after acupuncture. That's great. The striking actually bring down the blood pressure. Can you believe that? David, when you hit water crying, you have hit the jackpot. A lot of healing behind the tears. Yeah, that's good though. Aaron, thank you for that. Yeah. Ali, welcome to join us. Li Hong, yes, most patients get relief straight away after acupuncture. Yes, that's good though. Okay, thank you for joining us, for giving your advice. I appreciate that. Okay, now you see, what is our diagnosis? Our diagnosis is the fire is too strong. Then we reduce the fire. Who is fire? Heart and small intestine. So small intestine 7 is the son of small intestine. Small intestine 8 is the son of small intestine. We reduce the sun point, and reduce the heart sun point, which is heart 7. And we're going to tonify the kidney. The mother of the kidney is kidney 7. And Ziyin is UB67 is the mother point of bladder. That's it. I have to be quick. So 14. There's another time she came in. Headaches not too bad. Headaches not too bad, which means we're working pretty good. You know, getting better. Balance and talking are better too. The imbalance, much better. And talking, I can really feel it. She can talk smoothly. much clearer. And again, pulse. I don't care about whether we're using the same herbs. I think we're using the same herbs, right? Oh no, we use different herbs this time. So the same diagnose, the fire is too strong. The fire is too strong, we need to decrease the fire and tonify, increase the water. So that is 玄附花图, 黄连 7, 生地, 黄 6, 茯苓 1. Okay, those are the combination of herbs. 4 herbs. 4 organs, 4 herbs. Then same diagnose in here, but I use 4 herbs, but different herbs. So what it means right now in here, those two treatment, same diagnose with pulse, okay? But the same diagnose, same treatment principle, right? The principle is the same, but the herbs can be different. Herb is just a tool to heal your patient, to balance the organs. If I don't want to use herbs, I can use simply acupuncture. If I don't want to use acupuncture, I can use massage, acupressure point. If I don't want to use acupressure point, I can use moxibustion. There are many things that you can do. If I don't want to use moxibustion, I can use the herbs for patient to shower, have a shower with that. Okay, or I can use the herbs, put it in a belly button to make it work. Anything, any way that you can heal to balance the pulse, you can think of anything that you wanted to. So, or you can combine everything together. So we combine acupuncture and Chinese herbs. That's the most, the combination I most use in my clinic. Okay, this is the way that we do it. And sometimes I do give herbs to patients and get to have a shower or bath. Now, not everyone have a bath at home, so just pour the herbs into the body after shower. That's it. Because I can't, the two different. Why did you use different tools? Because the different tool can top up the credit. It can make patient even better. Some patient, it can speed up the results. That's why we add it on. If one thing is good enough, I don't have to do another thing. You will see later on when we cut down acupuncture and it came back again, which means the herbs working, but just the herbs is not strong enough. So you need acupuncture. By experience, though. I would like to say this is my thinking. That's why I use both a combination together. Okay, now re-examination. Okay, head exposure. The headache is actually 50% improving, 90% better in speech, 80% improve in balance, no bloating, and sleeping after meal, trouble staying asleep, wake but 2 or 3 times still. So no improving in sleep. In fact, sometimes wake up even more. It's not working and sleeping, right? But the others better. Of course, this is normal when you treat patients. Some conditions get better, some conditions get worse, some actually no change. That's normal. Scary dream, still low energy is improving because the headaches reduce, the energy is improving. Hot flush is not as bad, but still happening. Hot flush is not making her nausea as often. Feeling hot, prefer cold. Hands and feet are being colder. Vertigo is not as often. No puffy swelling, swollen in feet and ankles, but hand still puffy. But the feet and ankle, no puffy anymore. Libido is better. Budgie and fogginess in head is there. Affect her eyesight. Not seeing. Shallow breathe occasionally still. Dry cough is improving, but still there. No upper back sharp pain in left side. Difficult to make decision with foggy head is still. High cholesterol, high blood pressure. I don't know because no test. We don't know yet. Then next plan. They say, well, it's working, keep going for 2 acupuncture weekly and herbs. Let's go on. So I skip a lot of notes in here. So 16, 21st, 28th of August until 13th of 9, I use the same herbs. But I use the same diagnose, same strategy, but the herbs I added on 2 more herbs. That's for spleen. Okay. Now you will be very familiar if you've been to my workshop. Yes, acupuncture works very well in most cases. I do agree with that. I do acupuncture for just about all my patients, but I do have some patients that I don't do acupuncture for them. They just take herbs. If you know how to do herbs, in China, some Chinese doctor, they just do herbs. They don't do acupuncture. In China, the Chinese medicine is very different. Okay, they end up with what? When you do acupuncture, you do acupuncture. When you do Chinese herbs, you do Chinese herbs. And do Tuina massage, you do Tuina massage. They don't combine together. Which if we practice in New Zealand and any other countries, we do a lot. We do herbs, Chinese, Tuina, massage, and acupuncture. But I mainly do acupuncture in Chinese herbs. I rarely do Tuina. I don't do Tuina anymore. I used to do it. I don't do it because Tuina, time consuming. I help less people. I can help more people with Chinese herbs and acupuncture. Okay, now same diagnose principle is the same. If you learn, any of you been learning balance method acupuncture, already you have experience in learn acupuncture, balance method acupuncture, you've been to balance method acupuncture. If you have, please reply 1. Or global balance. Any of you study global balance already? I don't do it. I neither. I refer other person if they want massage. That's right. Maria Tan. Okay, global balance. You familiar with global balance? Dr. Tan's global balance. Okay. Now, when we do pose, we choose the point. A lot of time we actually doing global balance. Most of the time. So, 少阴太阳 using small heart, small intestine, kidney, and bladder. They're all 少阴太阳. This 少阴太阳 pattern, global balance. Now we're using this pattern, but also we're using pose to diagnose. Okay. So, fire, earth. So if you want to reduce fire, you reduce earth as well, because earth is the son of the fire. And you increase water. And water increase, they come in against the fire and against the earth as well. Right. So I call this iron triangle. It's very stable. So needle, reduce fire, right? Which means reduce small intestine, 8. Reduce small heart, 7. Heart 7 and 8 is the sun of the meridian. Then you want to reduce the spleen and stomach, right? You want to reduce the sun of the point of stomach and spleen. Then there is spleen 5 and stomach 45. Then you want to tonify the water. And the water is kidney and bladder. And you want to tonify the mother point, which is kidney 7 and bladder 67. That's it. So you see, diagnose, treatment principle. And when I use the herbs, same principle, according to my diagnose and treatment principle. And when I use acupuncture point, same principle. Now, how many of you, or how many of us that actually make the diagnose, one treatment principle, and herbs and acupuncture point are following your diagnose and your treatment principle? Most of the time we do herbs differently with the acupuncture point. We're not following the same diagnose in same treatment principle. You may not. Okay. Now, again, when it comes to on the 20th of September, no headache. That's good. No headache. Getting much better. Going back to work this week for 2 full days. That's great. Going back to work. Off work for 6 months. And about 1 month a bit of acupuncture. Back to work. How happy is that? Seeing an on patient now. Now, diagnosis still the same. The herbs still the same. So no change for the acupuncture point. Then again, had a headache, for a few days after last treatment. Hey, it works for all this month, but doesn't mean it's fixed. Doesn't mean that the headache won't come back. No. You see, after last treatment, the headache came back. It was okay. I will still take the pulse. Everything's fine. Still getting the same diagnosis. So I'm not saying, if patient get better, do we keep the herbs in and same protocol, treatment strategy? Most people will keep the same, right? I sometimes don't keep the same treatment protocol because I take the pulse. If the pulse change, I change my treatment protocol. I change the point. I change the herbs. If the pain, look, after last acupuncture, the headaches came back. I took the pulse. Still the same diagnosis. I do the same herbs. I do the same point. I did that. 2nd of October, the patient came in having a cold, all family sick with vomit and diarrhea, with a headache and body pain as well. I took the pulse. Even, the symptom changed. Much more other symptom came out. I took the pulse, same diagnosis. And same herbs, same acupuncture point. Then 11, and it got better with the cold. So you don't necessarily need to. Well, in here, I need to tell you something. I need to share with you something. Now, if you prescribe herbs, you have the knowledge in here. And if you're treating chronic disease, internal organs imbalance, then when patient had cold, you have to stop the herbs. Why stop the herbs? And you're going to treat the cold, the flu, 表症, right? You need to treat the 表症. You need to treat the cold first. Stop other herbs. That's what we normally do. With the way that you learn from the school. But when we do the pulse, we don't do that. I don't care about what symptoms that you suffer from, what you feel from. I only care about the pulse. What the pulse tell me is all the truth. What the pulse actually directly tell me the organs in balance. I just treat the pulse. I just balance the organ. I believe if the organs balance, everything will be fine. That's it. I treat it according to the pulse. And the cold's gone. And we examine again. Head explosion, 100% better. 90% better in speech. 80% improving in balance. No bloated and sleepy after meal. Trouble staying. Okay, I'm not continuing with the others. Okay, you can look at it yourself. But continue improving. That is what happened. Yes, word can confuse us. Yes, the body never lies. That's why. I agree with that. Okay, our goal, what's our goal? To reduce medication, headache, and avoid headaches. Okay? Because she hasn't reduced all the medication yet. We want to reduce that. Same to get you sleep better, because sleeping is still an issue. The balance organ function according to TCM. Now, you see, we cut down the acupuncture after 2 months. It was weekly acupuncture, twice weekly. Then we cut it down, 1 acupuncture treatment every 2 weeks because it works so well. The headaches all gone, just about all gone, 100% improving. That's what you say. 1 herbal prescription per week for 4 weeks. She came in every week to take the herbs, change the herbs, but she came in for acupuncture once every 2 weeks. And we're going to do a re-exam. Well, you see, we took the pulse. Now the pulse changed again. It's not the heart too strong. It's the lung too strong. When the lung too strong, hey, if you know how to use the pulse to diagnose, if you look at my video, the Zhening video, you know how to actually, if you go for it, you know how to do that. And you see, and I've been giving you all the herbs in here, and you just copy the herbs, and if you don't how to diagnose, you just use the same herbs for a patient. It will work. Differently work. You don't have to know about the theory behind how I get the ratio on there. You don't have to understand this. You just use it. You test it out yourself. It will work. Okay, this is the lung too strong. You know, it was fire too strong. Now, unfortunately, lung too strong. So when it come to pulse, you treat it according to pulse. It can be one or the others. It can be changed the next time. Hey, just believe yourself. Whatever you take, whatever you feel from the pulse, you just treat it according to the pulse. The body won't lie. It just tell you, I need this now. Just sometimes I use warm water every day, but the next day, I don't feel warm water. When I drink warm water, I feel just uncomfortable, and I need some cold water. The body asking for it. There's probably something attacked to my body and want cold now. And I just drink cold water, I feel much better. And the next day, I can't drink cold, and I have to go warm water. Just listen to your body. And when I say listen to your body, it's not the feeling, because the feeling will probably tell you wrong. But I say listen to your body according to the pulse. The migraine for 6 months off work, but she had an episode 12 years ago. But this time it's about 6 months off work for 6 months. Okay, we're treating lung. Now, global balance according to balance method acupuncture. You see, 少阴太阳 pattern and lung, large intestine, kidney, UB pattern. 2 basic pattern combined together. We're using pulse, but we are still using balance method acupuncture. Same thing. They both can match together. Okay. Now, we use the lung, we use this point, the sun point, right? And the sun point of large intestine 2 and large intestine is lung 5. And we use the kidney and bladder, which is kidney 1 and UB65. And tonify the mother point of fire, which is heart and small intestine. That's heart 9 and small intestine 3. 25th of October, put on 10 kg. Unfortunately, my herbs not helping her to wasn't helping her to lose weight. As she put on weight, that's probably not my herbs though. All the medication that she was taking and the steroid that she was taking, right? They put on weight. Not due to my Chinese medicine. I won't put it that way. I blame the Western medicine. Oh, just kidding. I don't know what actually causing the weight. But anyway, we're not treating the weight. You know, we are treating the headaches. Now, unfortunately, you see, we cut down the acupuncture treatment, right? The headache daily with painkiller. Headache came back. That's why we want to use combination treatment. And I cut it too fast, as you can see. Twice acupuncture weekly and cut it down to 1 acupuncture every 2 weeks. Because that's what patient asked for. And she's agreed with herbs every day, and she thought acupuncture could cut down. Okay, let's try it. I said, okay. But I said, if you cut it down, if the headache came back and we need it, we need to start it again. If a patient agreed, let's do it. And my patient might be right. I'm happy with that. So let's do it. Same diagnose. So the headaches there, that is the same protocol. And this one, same protocol as well. The diagnosis is lung too strong. So no change for that. And that one, headache again for 2 days, off work. Oh, getting worse. You see? Headaches again for 2 days, off work, even though she was taking the Chinese medicine every day. But her acupuncture is once every 2 weeks now. Very different. The regulation of acupuncture changed, but the herbs still the same. And then the headache came. And now she has off work for 2 days. Off work and can't work yesterday. Yesterday. And able to work and drive today again. When she came to see me, it was okay again. Nausea and loose bowel motion with headache. Nausea again and loose bowel motion with headache. And you see, I took the pulse. The pulse changed again. The heart too strong. So let's treat the heart. Then I talk about this point in the beginning already. In 15th and 22nd of November, same diagnose. So same point, same diagnose. 29th of November. Unfortunately, this case is getting worse. Have a look on that. What are you going to do if a patient is getting worse? Well, we sit down. So re-examination is very important. You don't want to just keep treating. You don't have time to communicate with the patient. So we make a time, sit down. The patient pay for it. And they come in for half an hour to an hour. We make it actually half an hour. And we charge the patient, sit down. And we go through everything. And we discuss with patient, look, it's getting worse now. The herbs daily, that's good. But the acupuncture, since we changed it to once every 2 weeks, it's getting worse now. What should we do? And I suggest patient, we should go back to twice weekly for the next 4 weeks, a month. And patient agreed because she didn't want to end up with headaches. You see, when patients get better, they want to quickly cut down the treatment. And it's our job to let patient know what's going on, what would happen, what is the expectation. And in the very beginning, I told patient already, we're going to cut it down slowly and cut it down to once weekly and for another month, and once every 2 weeks for another month, and once every 3 weeks for 1 or 2 months, and once a month, and maintaining. This is how we set it up. But patient probably didn't agree with that, and they want to go with their own mind, and that's okay because I'm not the one suffering from the pain. I'm not the one make the call for the patient, but I need to be in a position to tell patient, if you do that, that is okay, but it may end up with blah, 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 blah. You let the patient know what may happen. If this happens, we're going to go back to the other plan. If the patient agrees with that, that's okay. So don't make the decision yourself without your patient. You give the option to a patient, the patient decide what to do. This is how I do. Would you change formula as that's not helping? It may. But I trust my post. The post tell me what's going on. And I treat. When my patient came in, I do the post, I needle it, the headaches went away straight away. All the time. Never miss. So it means that my diagnosis is right and the herbs is still right. My herbs actually go for same principle as my post and the acupuncture point. So headaches has been bad in the last 4 weeks. So back to two acupuncture treatment per week with herbs, no change. Now this is very different now. I took the pulse. The kidney too weak. Totally changed. The kidney too weak. We tonify kidney. We tonify the metal. We tonify water, and metal is the mother of the water. When it's weak, we tonify the mother, and we tonify the metal. Then we reduce what? Reduce fire. Reduce fire. We're still reducing fire, right? So we reduce fire, and when fire go down, the water will go up. The metal will go up. So this is the heart herb: 生地、茯苓、生地 6, 茯苓 1, 细辛 9, 五味子 4, 玄附花 2, 黄连 7. Same principle. The point. We tonify kidney, water, right? What meridian is that? Kidney. And UB. And what point is that? Mother point. Kidney 7, UB 67. Then we tonify metal. What's metal? What are metal? Metal is lung and large intestine. And we're gonna tonify the mother point. Then we use lung 9 and large intestine 11. Those are the mother point. And we're gonna reduce fire. What's fire? Heart and small intestine. So we reduce what? Reduce the sun of it. And what is the sun of the heart? And what's the sun of the sun point of the small intestine? Heart 7 and small intestine 8. That's it. Okay. So how do we know it works? When we needle it, bang, the headache's gone. Then we know it worked. When we needle it, we check the pulse. The pulse, it was weak, and the pulse was like this. This is the kidney. You know, we take the pulse. This kidney is too weak in it, and then the pulse came back to match the opposite. Then we know it's working. I remember, Aaron said, I remember at the seminar that you told us pulse too strong or pulse too weak. At this point, you have gone for the pulse too weak. Why did you change from pulse too strong to too weak? Pulse to too weak. You can treat either too strong or too weak. You can change it. I've been treating, if you go back to before, I've been treating too strong, right? And my thinking is, all right, I've been treating too strong. It was working. Then the headache came back. Although I keep the herbs, but the acupuncture reduce the acupuncture treatment, right, to once every 2 weeks. Now I was thinking, wow, should I choose the weak one rather than the strong one? Yes, let's do the weak one then. The two options: once you can do the strong one, or you can do the weak one, right? So now I went to the weak one. Let's try the weak one and see what happened. If we treat the weak one, we put needle on, it works too. I use needle to try it. Okay. It can be both weak, both work too. But which one work better? I don't know. How do I know? Test it out. Does it make sense, Alan? This is my thinking. Yes, thanks for that. A good insight. Thank you. I'm happy to share everything here, because those my thinking, and that's how I do it. And I don't know whether it's gonna work or not. I try it out, and I needle it and check the pulse. And I ask the patient, "How's your headache?" The headache's good. The pulse balance. I know I'm right, and I give the herbs. That's why I want to give. When I give herbs, I feel when I start do this, I give patients just herbs, not acupuncture. I always doubted, what if this is the wrong diagnosis? The patient has to go back for 7 days. As I keep going, I gain experience. I have confidence now. Some patients say, "It's okay, we just do herb, no acupuncture. 7 days, come back 7 days." You know, it's just getting experience and confidence for you know, working again and again, it works again and again, something like that. Yep. This is the same. So there was painkiller every day before, right? And now what happened? Headache's better, no painkiller, which means the kidney one is working. Now I changed again, you see? I changed the tool, I changed the herb. I changed the herbs to a formula rather than using the single herb. I do it for Jing Fang. Why I do that? Because I want to test out whether the Jing Fang is better or the a single herb is better. Same diagnose, same treatment principle, but the herbs I can use single herbs. We call Yao Jing. I can use Jing Fang formula. Okay, I can use another formula called 大小泻心汤 according to 汤液经. According to 汤液经. So I can use a lot of different system of herbs for this patient to regulate the pulse. Okay, I use 四逆汤. 四逆汤 1 teaspoon. I don't use the tea bag. I use teaspoon. I said, what? Let's try 1 teaspoon morning and night. What is 四逆汤? 四逆汤 is for 少阴症. When it in 伤寒论, it actually for people feel cold a lot, all this thing, you know, people 阳虚, yang deficiency. So 四逆汤 is a formula that is when spleen too strong, we use 四逆汤. And I add on earth too strong, you want to reduce earth, you want to reduce what metal? The sun, right? Sun is the metal. Right. So when the metal too strong, we want to reduce it, we use 麦门冬汤. So two classical formula I'm using in here. Then the point is still the same principle. In the herbs, I reduce the earth and reduce the metal. In the acupuncture, I reduce the earth and reduce the metal as well. And earth means the spleen and stomach. And we reduce, you use the sun. And the sun point of spleen is spleen 5. Sun point of stomach is stomach 45. And the sun point of and reduce metal, right? And reduce metal, reduce the sun point, right? The sun point of lung is lung 5. The sun point of large intestine is large intestine 2. Yeah, if results don't match expectation, I always go back to review diagnose. Yes, good way. Yes, yes, always go there. Always go there to review to see whether the diagnosis is still the same or not. Do you miss out anything? Do we miss out anything? And if we do, change the diagnose and treat again. If the same diagnose, then you think about, okay, can I choose different tool? Can I choose different method? You know, the same diagnose, and can I approach different method for this case? You know, so yeah, I think we all do this. But this concept, you need to gain this concept, and you need to practice with this concept. You have to believe in it. That's how we do. That's how I do. And thank you, Szenan, that you share your experience. Rona, you PDF download. I'll show you PDF download later. Okay, now a month again. After a month, and we did 1 acupuncture treatment per week. We cut down to 1 acupuncture now, so much better. But now we're not from 2 acupuncture weekly. We cut down to 1 acupuncture weekly. We're not talking about 1 acupuncture every 2 weeks now. Okay, it's just different in here. Chinese herbs are the same. Okay, I skip a lot because so similar, a lot of things similar. So I skip to July. We don't have much time. So 1 acupuncture treatment per month. We cut down to 1 acupuncture per month. And for 2 months, you know, we cut it down to maintaining because everything's look good. Okay, and then we do one herbal prescription per month. So I prescribe the herbs for a month. You get 28 days of herbs, and then come back in 4 weeks. You know, we cut it down slowly. And then that's come to, there was July, September of 2019. That was the last year, right? So from 2018 to 2019, the patient said, well, I've been here for about a year. I said, right, you've been here for about a year now. That's great. Now, it doesn't mean it all goes smoothly. You know, he said, had a headache, again, 5 out of 10. That's why she came in. So I took the pose. Well, there's different wood assess. So we treat the wood. So we're using heat balance. This is heat balance. You see, heat balance according to balance method, acupuncture global balance, heat balance. So you reduce the wood, reduce the fire, and tonify metal. So the acupuncture point is reduce the sun of the fire, which is small intestine and heart, and the sun point is actually small intestine 8 and heart 7, and reduce the wood, which is liver and gallbladder meridian, and the sun point of liver is liver 2, and the sun point of gallbladder is gallbladder 38, and tonify the metal. The metal meridian is lung and large intestine, and when we tonify the mother point. And what is the mother point of those two meridian? Lung 9 and large intestine 11. That's very simple. So, okay. You see, we always think, oh, it's going to get better, it's going to get better. Patient get better is not always like this. If that's all the case, I will be happy, I will be the God. I'm not. So patient got better, drop down, it got better, drop down, it got better again, drop down, it got better, you know. Even in maintenance, I had a long drive with bad weather. It ended up with a lot of headaches and migraine again, and speech problem again, tingling a little bit, things like that, you know. Neck problem and liver too strong. She came in, so same herbs. Then another week, she came in with the herbs, feeling much better. Increase her work hour for another half day weekly. That's pretty good. Now this is different pose. Okay, running. So I use again. Running is chun, both chun, stronger than guan and stronger than chi, right? And I'm treating the heart and lung. And when treating the heart and lung, means that the small intestine is stronger than heart. Running is yang, strong, right? And the large intestine is stronger than lung. Small intestine is stronger than heart. Large intestine is stronger than heart. So with both of them, we use classic formula with 三黄泻心汤 2 and 小承气汤 4. Okay, and the point, yeah, we use large intestine 2 and small intestine 8. That's 3 sun point of it, and we tonify the mother point, lung 9 and heart 9. That's it. December, we came in December and everything's fine, no headaches, back to work full time. I didn't put it down, and they're all good. All medication cut down. I think she cut down enough with just half of medication with high blood pressure one, something like that. And all other medication all went down. And I said, well, you want to cut it down completely. You want to cut it down completely and go back and ask your doctor, consult with the doctor, because I'm not in a position to ask them to, you know, teach them, show them how to cut it down. Always go back to refer to the doctor, because this is a prescription, right? If they're stable and she's a practitioner and she understands the side effect of it, and she didn't want to be on it for a long time. So I gave it 200 teaspoon of herbs, 桂枝茯苓 one and 血府逐运汤 because it got hot flusher and it's got clot issues and stop the post herbs and I just do the general herbs for 桂枝茯苓 one and 血府逐运汤 to move the blood, and 1 teaspoon, yellow teaspoon before bed, and 200 grams can last for more than 6 months. So when I check on this, and we put recall for patient. So this patient should call this month. We haven't called yet. Probably next month. I think should call. Yeah, we called her and asked her back to get a review. We do that, and we give her some herbs. We keep in touch with patient. Okay, let me ask you a question. What is the best strategy for migraine? Is there any best strategy? I see on a lot of group, on my Facebook, and people always ask me, what are the best points for headaches? What are the best acupuncture method for back pain? Let me give you an answer right now. Do you have an answer for it? What is the best acupuncture method for headache? What is the best point for headache? What fits the client the best? Yes. David said, I don't trust general protocol. It depends on the diagnosis. Yes, it depends on the diagnosis. And I tell you what, I learned a lot of other strategies and other methods. I would tell you there is no best method, acupuncture method, and there is no best point for certain disease. Not at all. Now, Jordan said no best point. Yes, I agree. I totally agree with you. But I still have a lot of people ask me about what are the best point, what is the best point for certain things. And we look at this and I say, wow, you're still asking for this if you have a lot of experience with acupuncture? Don't ask me this question. Tell me what have you done? What is diagnosed? Tell me your diagnosis. Don't tell me what is the best point. Don't ask me what's the best point for headaches. Headache is a condition. It can end up with different meridian. The cause will be different. You need to give me more information, not just telling me, ask a simple question and want the final answer. There is no final answer. We are practitioner. I'm a practitioner. You are a practitioner. We want to get the point right. You want to treat your patient properly. You tell me what's going on with your patient. What is the diagnosis? What have you tried already? Does it make sense? The best point are those who matches to the patient case. That's right. Agree with that. It depends ROM, human condition and constitution. Yes, I agree with that. Someone just do it. Okay, Li Hong Yang said 200 gram herbs last for 2 months. How to take it? So 1 small teaspoon, very small teaspoon, 1 gram. I said not 200 gram though. I said 200 TSP, teaspoon. Only 1 teaspoon, yellow teaspoon. So 100 gram, or let's say gram, 1 gram, it equally estimate about a gram, right? So 1 teaspoon a day, 2 teaspoons, 200 a day. And 200 a day is about 6 months. Does it make sense? More than 6 months. Yeah, more than 6 months, actually not just 6 months, more than 6 months. So 3 months, 90 days. So 100 can go for a month. So underlying condition may respond different in each patient. I agree with that. Yes, because it is just what it is just maintaining to for patients who have clot issue, have blood stagnation issues. I prefer just little herbs every day to work with, because I tried strong herbs and sometimes it harms the stomach and spleen function, and it doesn't actually help move the blood stasis quicker. It doesn't always the case unless they are in a lot of pain, or which will use a lot of doses of the herbs. Otherwise, it's just small doses. And Jordan says different point for individual cases, no single point heal everything. I do agree with that. Thank you. Excellent. Thank you. All right. So my point isn't here. What is the best strategy? You have to have a full organ or 脏腑 organ functional diagnosis, and not just this 脏腑 organ diagnosis. You want to look at the structure imbalance, because the structure imbalance causing the headache, migraine too. Then you want to go to emotional. Is there any emotional trauma? So organs, structure, emotional, and lifestyle. All right. What time do they go to bed? Are they in a lot of stress at work or family issues? You want to understand all this to be able to give the best treatment protocol, the best strategy for your patient. So you can choose a combination treatment as acupuncture, moxibustion, Chinese herbs, emotional daily practice, diet change, heat pack, DIY acupressure point. All this thing you can give it to patient. Exercise, yes. Yes, I agree that neck is often the biggest contributor. Do you sometimes find it difficult to balance structure and 脏腑 diagnosis? I always find myself learning more towards structure diagnosis. Now, how I understand 脏腑 and structure, I think they have a link together. Let me share with you what is structure. Structure, we're talking about muscle, we're talking about bone, we're talking about joint, we're talking about nerve, we're talking about tendons, right? Those are structure. The bone without muscle and tendon contraction, it can't move. So structure, we're talking about muscle, we got tendons, we're talking about bone, right? Do we agree with that? Okay, now come to the organs. Who control muscles? Stomach and spleen control muscles. Doesn't matter where the muscle in the body. The underlying issue is the stomach and spleen weakness, or stomach and spleen imbalance rather than weakness. It can be too strong. We say it needs to be balanced. If one or the other stronger than the others or weaker than the others, then you need to balance them. Then the muscle will be better. That's simple. Now, kidney and bladder, both water. They control bone. When there's bone structure, so you want to get this kidney and bladder function better, balanced, then the bone will be strong. The string will be good. What about joint tendons, liver and gallbladder? And a lot of people remove the gallbladder, right? So when you remove the gallbladder, which means your liver need to work harder. To contribute the gallbladder function, to take over gallbladder function. Because according to Chinese medicine, they both are brother and sister. They're both twin brother or twin sister. So once you have this idea, you know those are linked together. When there's a structural problem, sure, they have a organ functional issues. So you need to know how to treat the organ functional issues. The structural problem, the chiropractor, physiotherapy, and osteopath, they can help. But I use GE acupuncture because I found GE acupuncture at the moment is I find it is more effective in structure. That's my own opinion. So if you're treating the organs, GE acupuncture is quite stimulation, strong stimulation for patient, So if the adult, I'll use GE acupuncture. But I see little girl, it was 8 years old. She came to me. I took the pose. I gave the herbs for sinus, and look at the head. One shoulder is higher than the other, and asked her to stand properly and take a picture and look at the spine. I said, there's structural issues. And I asked the mom, I can do acupuncture, but it's too painful. It's not suitable for this girl. I think I said, well, go to a chiropractor or osteopath to do the work. And it happened that they know a great chiropractor in the town, and they've been there before. And I said, go back to there, and you need to do it because still young and can very easy to get it back to normal. So don't wait until it's getting older and it started with pain, blah, blah, blah. It's difficult to deal with. Yes, if I can find the link, I will send you a good example for this how structure issues is causing severe migraine. I will share on the Facebook page. Thank you very much. Okay, now a combination are very important. Okay, so we offer a bird. So, this is a Taiwan class that I put it in here. It's not to do with you. This is not to do with you as well. It's a Chinese one. Yeah, structural issues, poor constitutions, musculoskeletal problem. Okay, the next thing. And here, now, if you want to get some thing for me, then this is the work I am. So would you please go to my clinic website? So step 1, there's a bonus. If you want a free medical aid to treat heart disease, lung problem, coughing, or stomach problem, diarrhea. If you want to learn the medical aid, it's free one. Please follow the following step. Please write a Google review for one of our clinic. Step 1, sign in your Google Mail account first. Then click this link. I just posted. Click the link to our website, and under the Facebook icon, the first Google icon, click it. Then it will go to the picture like this, the bottom one. Then you give us some star. There are 5 of them. I hope I can get 5 star. But yeah, you just give your star to us, to me, to review, and just comment, leave some nice comment if you're happy to do it for me. If you want the bonus, if you think that my webinar is actually helping you and share the real thing, that you learn something, please write a review for me. Then you screenshot and send the screenshot to my email, info@acupuncturetcmschool.com, and my team will send you the bonus video link so you can watch it. All right. Very good as always. Thank you, Eric. Okay. Now this is the last thing. I'll post it again. Usually it's the base of stagnation, poor muscular skill. the term form. Yes, we check the legs to see which side is shorter and or the rotation imbalance according to GE. But there are many ways, you know. Okay, I post it again. Now, as I said before, we have I'm planning to have a workshop in Auckland in November. I haven't got a proper date yet. I'll teach balance method acupuncture, local balance and global balance, okay, and as well as pose and how to choose those points, okay. Now, if you're in New Zealand, I know a lot of you are in New Zealand. Now, I'm not asking for the international practitioner from UK or from other countries to join us because it's not possible while the COVID-19. So I'm asking, will you be interested to join my workshop in Auckland? 3 days. 3 days. If you do, please reply me one. I want to know how many people actually interested. And you're welcome back to those who have been to our workshop. You can come in and get a refresh, and it's gonna be half price for you. And what happened for the others? If the new students, you join us, and I'll give you what my promise is. I'll give you. We'll record the 3-day seminar, and in the end, you can rewatch those video again. You know, you can rewatch it. No one will give you this. You know, I'm giving you this, and as promised, I'll give you the my webinar, local balance webinar for lifetime access. You can watch it again and again and again and again, again and again. Okay. Lifetime access to my live video, local balance. Okay. So I need to have enough people to be able to get this going in November. It will be in November. So I see that it's 3 people in New Zealand that would like to join and show the interest. If you like to join, please reply one. Hi, Kenny. Thank you for. Kenny said, thanks for participating tonight webinar. Please note that English webinar certificate will only be uploaded under the link below. Please join the following group if you haven't already done so. Thank you. Ali, I think you are not in this country, and you. But anyway, I'll send out an email and ask if you guys are interested. Please reply to my email. If you're interested, if you hear this right now, you show your interest, because I want to know at least probably 20 or 25 people are able to start the do the webinar. Okay. Good night. Good night. Good night. Thanks for great information. Okay. So the recording, I will put it into a Facebook group as well. Thank you, Jordan. Thank you, Tan. Thank you. Thank you, David. Thank you. Now, do you guys have any question? You can ask me any question about this migraine. Thank you, Phoebe. Thank you, Jing. Anything that you want me to explain. If you're all good, and thank you, good night, and thank you for being here with me tonight for more than 2 hours now. Ismail, thank you. Li Hongyang, thank you. And Udong, thank you. Thank you very much. Ying, Liu Ying, thank you. Ali. Yes, the video was put into Ivan, thank you. The video will put it into the group. Okay, the link will be in the group. San, Liu, thank you. Celia, thank you. Jane, Xin, thank you. Thank you, Rathanan. Good that you, Ali, you're in the group already. Just one question. There is 厥阴, Yangming, Shaoyang headaches. Okay, there is 厥阴, Yangming, Shaoyang, Taiyang in the back. Okay, but don't use this because there's different meridian, and especially in Yangming, it can be Taiyang in the front, Dumai, and Shaoyang in here, and Yangming in here. And on the side, normally people say on the side is Shaoyang, and that would be Shaoyang, but sometimes it actually cover the Yangming. So the best thing is get your patient, use one finger to show you where exactly the pain is, the jaw. Does it make sense? What do you call the helmet headaches? Helmet headaches. Or helmet headaches. Helmet headache is different. It's just say, well, it's heavy. You know, it's all over. There's a lot of meridian. Helmet headaches, a lot of meridian. Probably all the meridian involved with helmet headaches. The helmet headaches is normally the we call it what do you call it? Dampness. Dampness is causing it because it's heavy, right? Sensio, you're the best. Thank you for sharing your knowledge as always. Thank you. Incheko, thank you so much. I treat migraine with Ali Moon. I don't know about this. Sorry, Ali. Mucha, thank you. David Kuitai, thank you, David. What organ do you relate to? Okay, great, thanks. The helmet one, spleen then. Good night, Siri, good night. See you next time. Excellent. See you next time. Leech worm, if you like to make a video and share it with you. No, I don't want to use any more herbs at all. No, I know what you mean, leech worm. I think I can Google it, what leech worm. I have an idea, I just don't know about the English. Let's go to the Chinese one. I think I know what you mean. I don't use any more herbs anyway. So now you don't need to film the video for me. 水蛭虫. Oh, thank you anyway. Thank you so much. Sume, thank you. Aaron, thanks, Szenan, and have a great weekend. Thank you. I'm going up to Auckland tomorrow. Okay, that's it for tonight. Thank you very much for everyone. Then we'll lock everyone now. Same to you, yes. Better go to bed now because I'm going to Auckland tomorrow. Thank you, David, again. Rathana, I've not seen my certificate. Yeah, you're not going to get your certificate right now. It's in the Facebook group. You see what in the top, Kenny just post out, you have to join our Facebook group. So here is the PDF. If you want to, I forgot about this. Yeah. Kenny say, please give me a week or 2 weeks to upload to the group, please. Thank you. And Kenny, thank you. Thank you for all your hard work. And thank you, Daisy as well, for all your hard work. So if you want to download the PDF, please download. That's the PDF presentation. Tariq, thank you. Have a nice time. You too. Okay. Okay, if you guys are all good, no question, then I'm going to. Anyways, good night. Safe drive tomorrow up to Auckland. It's raining here. Oh, it's raining there. Okay, yeah. It's raining here too, Kenny. But anyway, thank you very much. Thank you everyone, and stay awesome. And I'll see you in my live video every day, 7 o'clock in the morning. Tomorrow morning, we're gonna go to the live video again. Thank you very much. Okay, I think someone is typing. Anna's typing. Anna? Anna, probably. Yep, I'm waiting for you. Oh, thank you. That's good then. So I'm gonna log everyone out now. Thank you for being here with me, and I appreciate that. Spend the time being with me, and stay awesome. See you. Bye bye. See you next month, and or see you in the Facebook group. Any question, please ask in the Facebook group, and I'll do my best to answer you. I'll give you an answer. Okay. Thank you. Bye.